Good place to start is in terms of the framework, because the posterior abdominal wall, as the name implies, when you think about a wall, you think of something that is strong, as something that helps to protect. We have walls around us to protect us. We have walls in our houses to protect us. We don't want people coming and hurting us in the night, so we have these walls around us. And the same thing can be said about the organs in the posterior part of the abdomen. They are protected by walls. There is an anterior wall for the abdomen, and there's a posterior wall. There is also a roof. We have roofs and we have floors. So there is a floor, which is in the pelvis. There is a roof, which is formed by the diaphragm. There's a posterior wall, which is formed by bony structures. And there is an anterior wall. Now, because we are looking at the retroperitoneum, the organs that we are going to be involved with are structures which are behind the peritoneal cavity. And you will remember that the peritoneal cavity is a smooth mesothelial layer, and it has little or nothing on the inside. What's in the peritoneal cavity? Normally, what would you expect to find inside the peritoneal cavity? Just a little fluid. Just a little fluid is in the peritoneal cavity. So the peritoneal cavity really has no structures as such inside. It is only a little fluid, and that fluid helps in allowing the bowel to slide one on each other. So if the amount of fluid in the peritoneal cavity is plenty, the only thing that is going to, or the common cause of fluid in the peritoneal cavity is going to be what? Infection. And that infection we call a peritonitis. But we are...
In females, we have ovary also in the peritoneal cavity.
Well, it's so easy to forget the women. That we cannot do without. We can't really do without them, and so we must remember that the ovary is within, and the tube, the ostium to the peritoneum is open in the female. So whereas in men everything is closed, sealed, in women there is a little opening, and sometimes through that opening, trouble gets in, because infection gonorrhea, gonococcal organisms can creep into the abdomen. But we need an opening in the female because the eggs need to go out. So there is the need to that. So remember that exception in the case of the female. Now, the retroperitoneum is behind the structures behind the peritoneum. And very important behind the peritoneum are the vertebrae. Think in terms of the third week of development. What is the structure that greets you on the third week? What is the embryological structure that greets you on the third week, during the third week? The third week opens up with a primitive streak. And the primitive node, they are midline structures. And those midline structures, in a way, foretell or tell us about the formation for mesoderm. And it is mesoderm that is going to provide both the sclerotome, from which we are going to get the vertebra, and the myotomes, from which we are going to get the muscles. Okay? So we'll have the Mesoderm, you tell me what the mesoderm divides into. Mesoderm divides into what? Come on, man. Table 1. Table 1. Help out these people, huh? Table 1. What the mesoderm is divided into? Huh? A paraxial mesoderm. Table 2. An intermediate mesoderm. And table 3. Lateral plate mesoderm. So we need the mesoderm to help in producing the partition. And so from the back, we are going to have the dermatomyotome. The dermatomyotome is going to give rise to the dermis. The dermis is coming from mesoderm. And then the musculature that we have along the vertebra, that is going to come from the myotomes. And then the sclerotomes are going to give us the bones. And so the posterior wall is going to have the lumbar vertebra forming a big part of the posterior wall. And if you look at the lumbar vertebra, you notice that there is a kind of a forward projection. And that forward projection is called lordosis. Lordosis. So refer to it as a lordotic curve. And what's the opposite of a lordosis? Huh? A what? A kyphosis. A kyphosis. Kyphosis. Okay, so the kyphosis is a kind of a lateral curve, a key on the side. So if it kicks out to the side, you get a kyphosis. If it's coming forward, then you have a lordosis. And it's possible to have a combination of the two systems.
Lateral bend is list.
A list.
And forward bend is kyphosis.
Kyphosis.
And lateral bend and the rotatory motion is scoliosis.
Scoliosis. So when you have both of them joined together with a lateral and a posterior, then we have a kyphoscoliosis. And sometimes you do have people whose spines are twisted, and that creates a lot of problems in terms of forward is lordotic, backward kyphotic. So lordotic and kyphotic, and a list on the side. So if they have the list on the side, and the combination, you can have more than one twist, and that will produce the kyphoscoliosis. Now, significant though for the anterior abdominal wall or posterior abdominal wall is the presence of the lumbar vertebra. And how many lumbar vertebrae do we have? 5. How many thoracic? 12. How many sacral? 5. Good. So the thoracic, lower part of the thoracic, T12, L5, the sacral, and the coccygeal, they are going to help in forming the posterior wall. Posterior wall. Okay? So we'll have a abdominal section and a pelvic section. Alright? Now, there are some muscles that hold the structures together. So on the back here, we are going to have these muscles. And important for the muscles is the fascia that holds them in place. The fascia that holds them in place. And very important for the fascia is the transverse process. Transverse process. So there is going to be a posterior layer or posterior lamella that has an attachment to the spinous process, and then there's going to be a middle layer attached to the transverse process, and there's going to be an anterior layer that is attached to the anterior part of the transverse process. Okay? Or that might even be attached to the body of the lumbar vertebra. You with me? So we have 3 layers, and these 3 layers are going to enclose how many compartments? 2 compartments. If you have 3 layers, you can get a compartment between the posterior and the middle, and something between the middle and the anterior. Okay? So the posterior spinous process is the attachment for the posterior lamella. The lateral transverse process, the lateral is the transverse process, is the attachment for the middle lamella, and the anterior transverse process, the anterior part of the transverse process forms the attachment point for the anterior lamella. So 3 lamella make up this fascia, and this fascia is referred to as the thoracolumbar fascia, or the lumbo-dorsal fascia, because it has some dorsal, it's dorsal, posterior, and it has a big part to play with the lumbar vertebra. All right, so you get the attachment. Now we have to set it up with some muscles, right? So between the posterior spinous process and the lateral transverse process, we are going to have a group of muscles. And I know you have paid it very scant regard. I know you have paid very scant regard to this muscle group. But you're going to find many patients coming in with problems related to the back, related to the posterior wall, and therefore if you don't pay attention to this, you will not be able to handle properly the diseases that patients are going to turn up with when they have back trouble. And back trouble is very common. A lot of days are taken off work. Millions of work days are lost because of back trouble. So it's something you need to know about. So there are muscles behind here, and they help in forming the posterior wall of the area. Now there are 2 superficial muscles on the wall, and one of them is related to the upper limb. Which is that? There are 2 superficial ones on the wall here, and one of them is related to the upper limb. The moment I say that, your ear should be propped up, and you would have the answer coming off the tip of your tongue. What is it? Latissimus dorsi. Hear the name? Latissimus dorsi, related to the lumbodorsal fascia. Latissimus dorsi is the only muscle that connects the pectoral and the pelvic girdle. Latissimus dorsi. Remind me where it is attached. Latissimus dorsi. Stuff you know already, and you say you pass. And maybe you got A or top marks in your 6-week course. But tell me, where is it attached? Hearing a lot of mumbling. Looks as if the 6 week came and went. leaving nothing behind. Like a serious rain, you know, just rain out and wash out everything. All right, so latissimus dorsi is going to have a connection with the floor of the bicipital groove, right? It is going to be the lady between two majors, between pectoralis major and teres major, right? And then it is going to have an attachment which is on the trunk, the lower part of the trunk, an attachment to the spines, the thoracic spines, from the 7T7 right down to L5, going right down to S5, going right down to S5. And it is also going to be attached to the posterior lamella, posterior layer, posterior lamina of the thoracodorsal fascia or the lumbar-dorsal fascia. It's going to have an attachment to the external part of the iliac crest, as well as to the four lowermost ribs, as well as to the tip, inferior tip of the scapula. So it has a pretty wide attachment, and it is much tied up with the thoracodorsal fascia. Okay? So that's one muscle. There is another one on the inferior part here, which is as well associated with the thoracodorsal fascia. And this one is, which one? The which one? Yes, the name is serratus. But which serratus is it? Serratus posterior inferior. There's a serratus posterior superior, which is attached to the upper four ribs. And there is a serratus posterior inferior, which is attached spinous processes to T10, T11, T12, L1, L2, as well as to the four lower ribs. So it will help in depressing the ribs and help in increasing the volume of the thorax. So it's a muscle of respiration. All right, so remember those two muscles, they are associated with the thoracodorsal, lumbar-dorsal fascia or thoracolumbar fascia, with the posterior lamella of it. And they are the latissimus dorsi and the serratus posterior inferior. Okay, now those are superficial. Should have remembered those. All right, so let us take a look at some of the deeper muscles.